So, we've talked about how our immune system helps to keep us healthy. This last chapter is when our immune system kind of goes awry. So, we're going to be talking about different things like allergies and autoimmune disorders. So, these are the different types of things that we'll be talking about in this chapter. So, when our immune system kind of goes bonkers and goes off the charts, when it's very hypersensitive. And first up, we're going to talk about allergies. So, when our body is responding in an exaggerated way. Another thing that we'll be talking about is autoimmune disorders. So, when our immune system turns on us. One of the cells that we were talking about in the adapted or acquired immune system are T cells. T cells are really important to regulating, and they're the mediators of our immune system. But when they turn on us, then we can be in big trouble. The last thing that we'll talk about is when our immune system responds inadequately, and that is going to be immunodeficiency. So, first up, we're going to talk about different allergies. And this is probably something that we can all relate to. We may have allergies or we may know people with certain allergies. This is when our immune system is making an exaggerated or inappropriate response. Now, depending on which arms of the immune system are activated, we can have different types of allergies. So there's four types of allergies. The first type of allergy is type 1. This is what we call the immediate response. If you notice that one kind of looks like an I, that's how I remember that type 1 is immediate. Immediate begins with I. You know how I like my letter associations. This is typically what we think of an allergy when we think of it. So typical allergy signs like itchy eyes, runny nose, maybe some different rashes. This can also lead to some serious consequences, such as anaphylaxis. And this can be really serious where the person can actually die from it. Now, this has to undergo several exposures. So we first have our sensitization. This is going to be our initial exposure, and it usually doesn't cause a big reaction. But what happens is that B cells are activated, and those B cells, if you remember, they produce immunoglobulins, and those B cells will produce IgE. IgE activates mast cells and basophils. Remember what mast cells and basophils release? They release that red flare gun, histamine. And histamine is responsible for those different symptoms that we can get, such as different rashes, itchy, watery eyes, runny nose. So usually the sensitization doesn't cause a huge reaction, but those B cells are activated. The big reactions usually come at that triggering exposure. This is when mast cells and basophils release massive amounts of histamine. Now, this triggering exposure, it could be the second, it could be the 15th. You just never know when that triggering reaction is going to happen. So I have an uncle and he has an allergy to bee stings, and he actually has to carry an EpiPen with him. So it was probably not that second exposure where he realized that he had a really bad reaction. It was probably some subsequent exposures. My brother, who lives in Texas, has a type 1 allergy to red ants. Texas has a lot of red ants, and he would mow his lawn and he would get stung by red ants, and he wouldn't have a huge reaction. But then he had some other exposures. One time he was watching my nephew play ball, and he was out in the sun and he had his flip flops on, and he ended up standing on a red ant hill and he got stung thousands of times. That was that triggering exposure. He ended up going to the hospital and almost going into anaphylactic shock. He's supposed to carry an EpiPen with him. Of course, does he carry an EpiPen? No, because of course he's my brother and he doesn't do what he's supposed to do. Considering there are a lot of red ants in Texas, I think he would be smart to do that. So, the really serious part of type 1 is that when we get this massive release of histamine, what histamine does is that it will actually open up the blood vessels. And so that can cause blood pressure to plummet. It can also cause airway constriction, which can then close off the airways, and then the person could potentially suffocate. So usually what people do to counteract this is to treat with epinephrine. And what epinephrine does is that it's going to constrict the blood vessels to increase blood pressure and open up those airways. So the risk is if the person isn't able to get that epinephrine administered in time and they end up going into anaphylactic shock. So people that know that they have this type 1 allergy will usually carry an EpiPen with the chance that they could actually have that reaction. Another thing that we might see with type 1 is what we call wheal and flare. And the wheal is the swelling. The flare is actually the redness. And you can see a picture right here of wheal and flare. And this is actually what they measure when they're doing allergy tests. So they can actually administer an allergen and then they can measure the wheal and flare to find out if the person is having a reaction. My daughter has several allergies, and there was one summer she came in and she said, "What is this all over me?" And I said, "Well, that is wheal and flare." She said, "Where's it from?" And I said, "Well, what have you been around?" What was causing that wheal and flare? I really have no idea, but it was very worrisome to know that she was reacting to something and that potentially if she came in contact with it again, it could be a triggering reaction. But this is actually something when you hear of people going for allergy tests, this is actually what they're administering and what they're measuring to find out what that person is allergic to. So in here, we can actually see a picture. So here we have that B cell, which is activated. And then on those subsequent exposures, again, it could be the second exposure, it could be the 15th exposure, we end up sensitizing those mast cells and basophils, and we end up with this massive release of histamine. Now, when people have a release of histamine and they get like those typical symptoms, like itchy, runny eyes, runny nose. It's not that big of a reaction, but the risk is if we have this massive release of histamine and the person can go into anaphylaxis. The second type of allergy is type 2. And this is the cytotoxic response. Now, the way that I remember that this is type 2, 2 begins with T and cytotoxic has 2 T's in it. So there's my letter association. This is what we can typically see if somebody is given the wrong blood type in a transfusion. So this is caused by antigens on the cells. And so the person that was administered the wrong type would actually have these anti-antibodies in their plasma that would actually attack these antigens. And this is going to activate the immune system. So this is going to increase phagocytes, turns on those killer T cells, recruits complement, and then we can end up with this huge inflammatory response with tissue damage. And so without getting too much into the different blood types, there are 4 different blood types. So there's A, B, and O. This does not count for the Rh factor. I will talk a little bit about that positive and negative. And so people that have type A blood, they will have A antigens on their red blood cell surface, and they will actually have anti-B antibodies in their plasma. So that if a person with type A is erroneously given type B blood, those anti-B antibodies are then going to start attacking those red blood cells with the B antigen. And this is going to cause this huge inflammatory response. Now, I've heard from students that have actually seen transfusions gone wrong. It's really a chaotic situation where you've got people jumping over gurneys to get to the person to basically to rip out those IVs. So it can be a really serious thing. The other thing that we might also see this with is with the RH factor. But first up, just a little picture so that you can see if somebody is given the wrong transfusion. Here's that wrong blood type. So that red blood cell has antigens, and the person has those antibodies for that antigen, starts attacking them, and then we start to have this whole inflammatory effect. So we recruit complement, and then we start to have this big inflammation and tissue damage. So here's a little visual on that transfusion gone wrong. The other thing that is a concern when we're talking about blood types is the RH factor. And this is really a concern for pregnant women that are RH negative. Now, as we know with blood types, we usually hear about a positive and negative. So, for example, I'm O positive. What does that positive and negative mean? That has to do with the RH factor. And so this has to do with an antigen on the red blood cell surface. But the difference is that the person actually that doesn't have that antigen doesn't start making those antibodies until they're actually exposed to the antigen. It's inherited a little differently, and there's different genes around that. But this is an issue for women that are RH negative. So if we have an RH negative mother and they are pregnant with an RH positive baby, during the birthing process or even in a miscarriage, some of that fetal blood can actually go into the mother's, and that mother can actually see that antigen. So when the mother sees that antigen, now she's going to start making those antibodies towards that antigen. Those antibodies are going to go out and they're going to start to attack those antigens. It's not necessarily an issue for the first pregnancy, but it can be an issue for subsequent pregnancies. So if the first baby is born and then the mother is pregnant again with another RH positive fetus, now the mother's antibodies, those anti-RH antibodies, can cross over into the placenta and start attacking the fetal blood. This is what we call erythroblastosis fetalis. This can be very serious for the unborn baby. So usually women that are Rh negative, they're actually given a shot of RhoGAM. And this is a case where we have those antibodies that are given. Antibodies are given, and then what they're going to do is that they're going to tie up any antigens that could possibly cause the mother to have a reaction. So they're going to go out, tie those up before the mother actually sees those antigens. So usually this RhoGAM shot is given at various times during pregnancy, especially in the first pregnancy. And I've heard from women that have had that shot that it is very painful. I have a friend who is Rh negative, and her first pregnancy resulted in a miscarriage. And she was going to some fancy doctor's office in New York City, I think like the Upper West Side. And she actually had to tell them that she was Rh negative and she needed the RhoGAM shot. The doctor actually didn't have any of the RhoGAM in the office, so they basically sent her husband going through the city, going to different pharmacies trying to get that RhoGAM shot. And it was something she ended up going on to have 3 children, and it was something that was a concern. And she would have to get that RhoGAM shot for each pregnancy just to be on the safe side. The next type is type 3, and this is the immune complex. So if you notice those 3 ones are kind of put together, I kind of think of that as like this complex. So type 3, this is when antigens in vaccines, microbes or host cells actually cause these large antigen antibody complexes to form. Now, normally these complexes are cleared in the liver and the spleen. And so if they aren't cleared, then the person is reactive, and that's when they can actually have this big inflammatory response, and it can cause tissue damage. There are some different examples of type 3. So, for example, serum sickness. So, this is when somebody is is given something to actually help them, and the immune system sees it as foreign. These complexes can form. And some of these reactions, some of these complexes can actually settle in different places. And this is actually what can happen with rheumatoid arthritis. And rheumatoid arthritis can be an autoimmune disease. And when these complexes settle, then they're going to settle into the joints, and the person can have issues. Another case of this is lupus. And we'll talk a little bit more about lupus. The interesting thing about lupus, depending on where these complexes settle, the person could actually have different symptoms, and it can present differently, that it can actually be really hard to diagnose. And I'll talk a little bit more about that when we get into our autoimmune disorders. The last type is type 4, and this is what we call the delayed reaction. So this is going to take longer. This is not going to be an immediate reaction. We would put reaction within maybe 48 to 72 hours. This is going to be cell mediated by those T cells. And we often see this with contact dermatitis. So if somebody has a contact dermatitis, basically these T cells are going to be activated, and then they're going to have a reaction. Again, this could be a delayed reaction where it's going to be maybe 24 hours later, maybe even 72 hours later, that they're actually seeing this reaction. So my mother was very allergic to many things, some different detergents and makeups, and she would actually have delayed type reactions. And so she knew to stay away from different cosmetics. There was one particular cosmetics, Estee Lauder. I probably shouldn't mention the name, but she had a lot of reactions to that. So she would go to great lengths to avoid like the department store displays of that particular cosmetic. She would actually go out of her way to go around them. I was never allowed to bring that makeup type into the house because she felt that she was so reactive to it. The problem with delay type is that because it is delayed, it might be a little difficult to figure out. So if people are having reactions, they're trying to go through anything that they might have been exposed to in the last 24 to 48 hours. Did they change maybe their laundry detergent, or did they use a different soap or moisturizer? What were they actually exposed to? So it can be kind of tricky to figure out what actually that allergy is to. Now, it's not all something that you might have been in contact with, like makeup or soaps or detergent. It could also be something that's ingested. So I have a friend, and she actually has a type 4 allergy to lactose. Now, this is different than being lactose intolerant. Somebody that's lactose intolerant, they're not making enough of that lactase, that enzyme, to actually break down that lactose, and that can lead to all sorts of GI effects. What she has is a type 4 allergy. So when she has dairy products, she has a reaction to it about 24 hours later. So it is not a lactose intolerance. So recently, she accidentally ate some cheese in her refrigerator that she thought did not have lactose in it. And she realized her mistake, and she said that she just sat down and cried because when she had had these reactions, it was an awful, awful, awful reaction. And she knew that it was probably going to take about 24 hours. So she was kind of like on watch for that 24 hours, waiting for those horrible symptoms to hit. Fortunately, she did not have a really bad reaction, but it's something that she has to be concerned about. So, how does the type 4 happen? So, this is when those T helper cells get sensitized and they start to release those immune chemicals, those cytokines, which then activate the macrophages. And then this causes that big inflammatory action. So, if somebody has like a contact dermatitis, it could cause like one of those skin inflammatory reactions. Or in the case of my friend that actually has that type 4 reaction to dairy products, it's something that is going to cause some GI and other effects as well. Now, if somebody has an allergy, it doesn't necessarily mean that it's going to fit neatly into these boxes of type 1 through 4. If somebody, let's say, is allergic to a certain type of drug, it could actually be any of those types. Oftentimes, chemicals are too small to act on an antigen, so they're actually bound to proteins, and that's what causes that hypersensitivity. And we know that drug reactions are an issue. This is one of those reasons why, when you go to the doctor, the first question they ask you, are you allergic to any medications? Because they certainly don't want to prescribe something that's going to make you sick. So, when we have these different allergic reactions, they don't always fit into these certain boxes. It could actually be a combination of different types of allergic reactions. It really depends on which parts of the immune system are actually activated. So, these are the different types of allergies. I know that we mostly think about the classic allergy as being type 1, but there's actually 4 different types of allergic reactions. And again, it all comes down to which parts of the immune system are actually sensitized.